Hey, I'm Dr. Hamilton. I'm here at Inland Valley Integrative Health. I wanted to talk about today is a little bit about decompression. Decompression is probably one of the best things we have in our office. It's helped so many of our patients not be reliant on medications and save them from having surgery. I think that second one is my favorite. Who wants to have surgery? That's just not a fun time. So what we're going to talk about is what this table actually does. So important thing about decompression, this is the way my office works. If you're in decompression, you have to be getting actively adjusted. The reason why, when we look at these discs and they're all broken down like this is the disc in here. And a lot of times what happens is these disc bulges, they get stuck, and what ends up happening is these bone spurs start to form around here, and they'll start to try to basically fuse themselves off. And of course, they're going to be pressing on the nerves and causing problems with the nerves. So the adjustment, what it does is kind of breaks these up a little bit, allows them to start moving, and then when we decompress it, you get much more benefit from it, and you don't need as much decompression because you're actively getting adjusted. So one thing I always like to go through is, why is this decompression important? So, and it's important for these discs because these discs do not have any blood supply, all right? That means there's no blood going in here, and once your body stops moving, these discs are not getting the nutrients they need to maintain and heal themselves. So say you get injured, you slip, fall, hit the floor, whatever it is, you bend over, pick up something, your back gets hurt. What ends up happening sometimes is your body starts to lock up and block this from moving. And then that's the initial injury that actually starts hurting this disc. This disc will not get its nutrients because all of a sudden it stops moving, and then it starts to swell up, and it'll start putting pressure on this nerve. Wherever this nerve goes, down your leg, it can also go to your digestive tract, your intestines, and cause problems there. So once that starts to happen, you'll start to see the changes in your body. So what the adjustment does is loosens that up and starts to move it. But if you have that compression, that space is going to be really hard to get back. And if you're already having some severe sciatica, or just, we call it radiculopathy down into your legs, or even if you've been told like the only way you're going to solve this is surgery, I would really recommend trying a different option. The best outcome for spinal surgery is about 23% success rate. If you're making an investment and they tell you there's a 23% chance of it working, you're probably not going to make that investment. At this office, we have, right around 90 to 95% success rate with this table. This table really does wonders for people. So what it does, you get strapped into these straps right here, and this table moves, and basically we hook up to this strap right here, and what it'll do is it'll pull. And as it pulls, we can go anywhere from 50 pounds to 150 pounds. This table has a lot of power. And what it does is it pulls and relax and pulls and relax. And what it will do is it will naturally start to pump these discs. And at the same time, when the disc starts to get these bone spurs and crust on it, it slowly starts to break that apart. Slowly is the key word. You do not want to do this fast. I have lots of people coming here, oh, crank it up, we can do this, I can take it. It's not about that. We want to do it slow and steady for the best results and the least amount of discomfort to you. So we want that to go nice and slow. So as it goes through the treatment, it pulls, and it'll pull for a few seconds, anywhere from 10 to 20 seconds, and relax down for another 10 to 20 seconds. And as it pumps that disc, it passively allows these discs to heal themselves. It's a great tool we have in the office. And one thing I always have asked in some people that come in, I already have a chiropractor. I like the chiropractor I have. That's great. I encourage you to go to your chiropractor. But can I do the table? Of course you can. If you're in an active treatment plan with your chiropractor, you're being adjusted at least once a week, this program is open to you. You can always do it at this office. We have packages set up for that, and we recommend at least 16 pulls, and all the way up to 30, 36 pulls. We'll figure out what the best benefit is for you on your initial exam.